Hi guys, welcome to this show. In this episode, I am going to interview a very talented young neuroscientist from Portugal, Dr. Cleviio Nobrega. There's so much interest regarding coronavirus, and I was overjoyed to know that one of the scientists that I know is working on coronavirus. So I immediately got very excited and invited him for this show. I'm so lucky that he accepted my invitation immediately without hesitation. It's my pleasure to invite Dr. Nobrega to this show. Hi, Cleviio. Thank you so much for accepting my invitation to come to this show. It really means a lot. Let me start this show by asking you about the coronavirus situation in Portugal.
So I think it's a little bit similar like in the other countries. Now, and these are the numbers from today, we have almost 90,000 people infected with the coronavirus. Unfortunately, we have 639 dead. But we have also a good news. It's because we have almost 500 people recovered from the infection. So it's not so. It's not. The numbers are not so alarming like in other countries of the south, like Spain or Italy. But even though a lot of people is dead, and it's always a pity thing and an unfortunate thing.
So why is that the coronavirus situation is not very bad for Portugal as compared to Italy and Spain? Because geographically you are quite close to each other, right?
Yeah, I will tell you one speculation and one thing that I think it's in fact one of the causes why we have these numbers. Our government started to put the partial lockdown and the complete lockdown rules very early. So I think that in Spain they already had more than 600 cases when the government started putting this type of measures. Here in Portugal we had 6 cases. So we started earlier with the social avoidment and something like and the lockdown of some of the partial of the restaurants and the shops, and I think that's one of the explanations. And it's in fact I think one of the best explanation for that. The other is that I don't know if people. So in these days there are a lot of association things, and one of the things that people are talking, and scientists, but it's not nothing established yet, is the relation of the vaccine against tuberculosis, that in countries like Portugal it's mandatory and we all had this vaccine, and in countries like Spain or Italy it's not mandatory. Of course, this is only a speculation. There are a lot of studies, and I know that in Australia they will start with a massive vaccination of health professionals to see if somehow this can not prevent, but somehow that the infection of the new coronavirus will be a little bit more mild and with less symptoms. Because that's another important issue. We have of these 9,000, almost 9,000 infected, we have only, I think, less than 2,000 in the hospitals. So most of the people are recovering at homes. Of course, some people with mild symptoms, but they are recovering at home. So that's another good news for the hospitals, but also for the people, because they are in a more friendly environment than in the hospitals. I don't know, this is only a speculation, but I think the main cause, it's like I mentioned, it's because of the early measures that our government took.
All right. Wow. So that's really interesting. So you're saying that the vaccine against tuberculosis is somehow protective?
Yeah, and I think if you Google, there are some interesting maps where they put the maps where the vaccination against tuberculosis, that it's called BCG, it's mandatory, and the other countries which is not. And if you merge that with the countries most affected by the new coronavirus, it's
All right.
somehow similar. Of course, at the moment, it's only a speculation, but of course, it's a speculation fundamented in some scientific, at least association, not evidence, but association. I think in the future, we'll have some of these associations.
That's great. I mean, sometimes it feels like there is no ray of hope. So whatever works, it's really very interesting to know this.
Yeah,
And
yeah.
I'm sure that a lot of audience would be very, very interested to know this finding or association about tuberculosis vaccine and coronavirus. So thank you for providing insight into this. Now the question that I'm really, really interested in knowing, and that is, what are you exactly doing? I heard, vaguely that you were screening coronavirus patients. Could you care to give us a little more detail about?
Yeah, so I'm currently working at the University of Algarve, that is in the south. I'm the director of the Center for Biomedical Research. So we are a research center, not screening. But of course, because of the centers and the university closed because of the government measures, we took a plan in action to help the hospitals, to help the national laboratories to do the screening. Because we had the expertise, we have the laboratories, the conditions, the reagents. So for us, I will not say that it was simple or easy, but it is more easy for us than for people that doesn't know about science or are not scientists. So what we did, because our government launched 2 weeks ago a massive test to all people that are in the nursing homes. It's a huge problem if some of those old people and that are more vulnerable get infected. So our task was, and this being, of course, to test all the old people that are in nursing homes here in the region of Algarve, that is in the south of Portugal. It's around 6,000 old people, and of course, I cannot disclose all the results, but there are very good results because we got very few infected until now, and that's also a hope for the people that are more vulnerable. So, in simple terms, we are doing the screening like the hospitals and the national laboratories are also doing, not to compete, but to help them and to increase the capacity of the country in doing tests.
Wow, that's a great help. I talk to my sister all the time that, scientists do PCR, qPCR, or RT-PCR regularly. Why not use our skills to help doctors and whoever needs it to speed up the diagnostic process of coronavirus? So may I ask, what are you exactly doing technique-wise?
It's a qPCR, which is simple. We had 3 machines for that. Normally in the hospitals they have only one. We had 3. We asked another center to help borrow one to us. So we had now 4 machines working, and we have 2 group of volunteers. It's all volunteer researchers, not because we cannot oblige anybody to do this. So we have 2 teams working together, and we are now processing around 300 samples per day. So it's a good help for here, for the region and for the country. And let me say that almost every research center in Portugal did that. They stopped the research, and we are all helping in doing this massive screening. First to help professionals and to the old people.
May I ask, who are you actually screening? For coronavirus, are you screening only sick people, or are you screening healthy people as well? Are they coming to you?
No, at the moment, no. We probably in the next phase. It depends how the infection, the progression of the infection. But for now, we have a team of medical doctors or students of the medicine course. They are also volunteers. They go to the nursing homes. They sample the old people and also the people that are working there. Help.
Okay.
So and then they bring us the samples and we analyze at the center. At the moment, we receive sometimes one or two samples from the hospital just to confirmation, or because they have they don't have the capacity because they are already doing other things. But at the moment, it's in this basis for all people.
What do you think, in your opinion? Is it even possible to do a mass screening of population, like not just sick people, but also healthy people?
I think it's not possible because of two important things. Well, one, because I think even with countries with the huge capacity to do tests, everybody in the world are looking for reagents, for tests, for kits, and and the production of the world, it's impossible to increase, and it's impossible to meet all the demands. And I think in that point it will be impossible. So technically impossible.
All right.
The other question that I think it's also important is that it could get, if we do screening to the whole population, it can give a false sense of security, because if I get a negative result, I could say, yeah, I'm okay. Yeah, but a negative result doesn't mean that tomorrow I can get also infected tomorrow. I'm not immune because I got a negative test.
Exactly.
That's different things. That's different things. So I think we can increase the number of tests, and I think we can start like we are doing here in Portugal, first with the most vulnerable people, so health professionals, old people, and probably risk like immunodepressed, people with diabetes, something, and then we can go even to schools, because not because they are children are more vulnerable, but because they could spread more easily, because children are children, and because of the professors also, and we can go like that, but not in the like at the for everyone at the same moment.
So you're so right about this, because I hear many people from my country, India, complaining that unless we do a mass screening of the population, we would not be able to keep this disease under control. So I was thinking that mass screening was the way. And here you're saying that it does not give you a guarantee. It might tell you that today you're not sick, but it doesn't guarantee that tomorrow you cannot be sick.
That's an important question that people should think about. And even if I got the moment a test today, I could be infected yesterday, and the test is not detected today. It could be detected only in 3 or 4 days. So I think we all should be careful. This is a huge problem for the countries, and I think at the moment people like us scientists, but also more young people, should be responsible, stay at home whenever possible, avoid the social contact, especially with vulnerable people. I think we have to think that in people with with more than 70 years, sorry, we have a mortality rate above 15 or 20%. So we have to be very careful about those people. And so I think that's the best measure and the best action that we can take. Be careful.
So what is your opinion about this partial reopening of countries? So Denmark, where I live, is going to partially reopen in 2 weeks. So what is your opinion on that? And how is it looking for Portugal? When is it going to reopen, partially or completely?
Yeah, well, we cannot be in lockdown forever. That's a question. And for example, here in Portugal, we are growing in the number of infected around 3% per day. So to get all the people, to get the immunity group, we could take years, and we cannot be in lockdown for years. So I think, yes, we should start with careful and opening some, I don't know, some services gradually, and people should also be reminded, I think every day almost, that we should, even if things start to open, we should still maintain the same procedure and take the same security measures to avoid, to not only to be infected, but especially to infect the others. I think that's one important thing. Here in Portugal, we still don't know, but we are talking about also in the beginning of May start opening some shops, some restaurants with with some restrictive measures. We already know that schools will not open until the end of the trimester.
And then I'm reading a lot of articles, and they are saying that a vaccine is going to be prepared in 2 months or 3 months. And my experiments took so long that it's a little bit. It's becoming hard for me to believe. I would be very happy if that happens, but I am a little bit skeptical. So, what's your take on that?
Yeah, I don't know if we. So one thing is that I hope that we could have the vaccine in 3 months or in 2 months. Honestly, I will be a little bit skeptical in that deadline. But I know that a lot of labs, a lot of scientists, researchers are working almost 24 hours a day, 7 days a week, to have a cure, or at least to have something to give people. So I think it will be more rapid than a regular vaccine, or than for other diseases that we are still in the field trying to have a cure. But honestly, I think that will be difficult because of the test and all of the rules in 2 or 3
the
months.
regulatory
And
process.
then that's another thing that people have to take into attention. So even if in 2 months we have a vaccine, we will take at least 1 year to produce for the whole population, and for the population that have access. And we should be altruist at the point to give the vaccine to people that are more vulnerable to that. Of course, and I think we have also to keep that in mind, because if a vaccine in fact exists in 2 or 3 months, all countries in the world will want that vaccine. And the production, of course, it has a lot of limitations. So that's another point that people should know.
Yeah. So what I think sometimes is that these viruses are always going to be there. They infect not just humans; they infect plants and fungi and whatnot. So we need to learn to live with them, right? I mean, there's no way around it. They are parasites. They're going to look for vectors to live in, and they're always going to want to infect us, right? So we must accept that they are there and do what is necessary to prevent such a pandemic, right?
Yeah, without any doubt. So the story of virus and humanity, it's for centuries and for million years. So yeah, we are here, but they are also here. And this is an example, but it could happen in, I don't know, in 1 year, in 10 years, in one century, but it could happen again. So we should be careful, and I think we all should and have to keep in mind that we are only, even if we a human being in this world, even if we think that we are the top of the chain, well, you have a small virus that completely changed our lives and our way of thinking. So I think we have to think also in that and in the future.
Learning a lot from this invisible enemy, right? There's lots to be learned.
Yeah, a lot.
Now I'm going to ask you the exciting question. Are you also into developing treatment for coronavirus? Because I know you were also into developing treatment for, other neuroscientific disorders.
No, we are not doing that. So what we are trying to do, and we probably will start next week, it's to developing a new diagnosis test that will be rapid and cheaper. So because, very briefly, and not entering into much details, so currently the test, we have two steps. The first one, when we extract the genetic material from the virus, like we could do, like with our cells. And the second step, where we go to detect if that sample has or not the presence of the virus. Yeah. So currently the process is like that. So we have the first step of extracting the genetic material, and then a second step of detecting by PCR, by qPCR, if the virus is on that sample or not. What we are trying to do is to do a direct PCR without the extraction step. It will be easier because it will be more rapid, and also it will be cheaper because we will not need the reagents for the extraction step. But we will start the tests probably next week on that.
I hear that Emirates or many airlines are talking about screening people before they get on board. And I was thinking, how is that going to happen? Because it took me 2 days to do a PCR, and these airlines are talking about the screening in an hour or two, you know.
Yeah, I think we are not the only one in the world doing that. I think in the next months or even weeks, we could have more rapid diagnostic tests, and I think that's also very important. We are all thinking in the vaccination, which is crucial, but at this moment, it is also very important to improve our diagnosis test to be to be quicker and to be cheaper. And I think that's another important point in this fight against the new coronavirus.
So what about the home-based test? Some people are talking about, you know, using this kits where you prick your finger and get blood and do this test. What do you think?
Yeah, I think it will happen. I think that there is a lot of companies interested in that because it will have a huge market, as we all believe. Again, I think we should be careful about that. I know that, for example, there were a lot of examples of diagnostic tests that didn't work, that were sold like they were very good, very rapid, but only 10 or 20% of those tests work. So we have to be careful in ensuring that the sensitivity of the test and the specificity of the test, it's around 95, 98%. Otherwise, we could get a negative or a positive that it's wrong. And of course, we could take measures based on those wrong results. So I think that's a good thing, but it should be taken with very careful.
Wow, thank you very much. I had no clue about a lot of things. You give me, and also I'm pretty sure the audience, a lot of valuable insight into not just the screening part, but in general, interesting stuff regarding coronavirus.
No problem. Thank you for the opportunity, and thank you also for your work. I think it's very important for us scientists to explain, because we have somehow the knowledge, and it's important to share the true news, the true information for the people to be rest. So this is bad, but it's not, at least for a lot of people, the end of the world. So I think it's very important what you are doing, and what people and what researchers are also doing around the world, that it's trying to explain the people the correct and accurate information.
So thank you very much for watching this video. See you real soon with another great topic, an interview with another talented young scientist. Don't forget to stay tuned.